Okay, good morning, everyone. Again, hi. Sorry for those of you who have already heard me say this. It's just a few minutes now after 9, and I think the majority of people are logged in, so that's great. I think I'll start us off. So it's Kelsey Gallant. Good morning. We're here this morning to talk about, well, to look at and talk about the Telus Health Dashboard in the Wolf EMR, which for any of you that have already participated in the MedAccess training is going to look very similar, if not maybe totally identical. But we're here to talk about that in the context of the Wolf EMR. I'll let Pierce Han from Telus Health share more, but this is actually a relatively new feature for the Wolf EMR, so it's exciting because the users haven't really had any exposure to this, and our PST work will be one of the impetuses for that. So Pierce will share a little bit more about that. We have an hour and a half booked. I don't know that we'll use it all. We'll try to end early if possible. As per our normal format, please feel free to ask questions as we go. You can either do that by asking a question over the phone, or you can also use the chat feature on the WebEx and type a message to the group or just to myself. That would be under Erin Picard, the host profile, and I can pose the question for you. Also, just a reminder, there's at least 15 of us on right now. If you're not actively speaking and you're in a louder environment, if you wouldn't mind muting yourself. If we end up getting feedback, like if I can hear background noise from your call-in ID, I may have to mute you, in which case I'll try to send you a message. But if you can, just go ahead and proactively mute yourself. That would be great. Also, we're recording this, so you'll have the opportunity to refer back to it at a later date, just as you need to go in and prepare for practice visits and so forth. I think that's all. So without any further ado, I'm going to pass it over to Pierce Han from Telus Health, who's going to be walking us through the Telus Health Wolf dashboard for the PSP panel management work. Over to you, Pierce.
Thanks very much, Kelsey. Thanks for the intro. Hello, everyone. Yeah, as mentioned, I'm Pierce from Telus Health, and what we'll be doing today is covering the PSP panel management dashboards in the Wolf EMR. Kelsey, would it be all right if I just do a quick roundtable, I know I've probably met some of the people on the line, but maybe not everyone.
You know what? Yeah, that's a great idea, because actually many of you are logged in as call-in users, so I can't actually fully tell either. So yeah, let's do that. Do you want me to roll call out maybe health authority teams? Do you want to do it that way?
Yeah, that'd be great.
Okay, so why don't we start with Vancouver Coastal? Who do we have on from Vancouver Coastal?
It's Brian.
Hi, Brian.
You? Hi.
Hi, it's Ronnie.
Hi, Ronnie. Hey, you guys are the lone two?
Good. Yeah.
Okay, what about moving on to Fraser Health?
Hi, good morning. This is Pauline Dan.
Hi, Pauline.
Oh.
And good morning. This is Sophia Tanaka.
Sophia.
Good morning. Okay, that might be all from Fraser. What about over to the island?
Shelley from Victoria.
Shelley.
Hi, Shelley. You're new to the team, aren't you? We haven't even met.
No, we haven't met. I've been with the team since October.
Oh, okay. So sorry, you're not that new. But hello virtually. I look forward to meeting you in person, hopefully in the spring at a full PSP event.
Awesome. Thanks.
And Tanya and Liz from Victoria, and we're both fairly new to the team as well.
Okay.
Hi, and good morning. Nice to meet you guys, too.
Thanks.
Erin Luke.
Hi, Erin.
Hi. Anna from Nanaimo.
And Mai's here from Central Island as well. We got a big island
group
represent.
Yeah, nice.
Morning.
Good morning. Okay, that sounds like it was the VHA team. What about Interior?
Hi, it's Jo from Kamloops. I think I might be the only one. I'm not sure. Yeah.
Oh. Yeah, you might be. Okay. What about Northern Health?
Leanna's on the phone. Leanna from Prince George.
Hi, Leanna.
Hello.
Hi.
Margie from Quesnel.
Hi, Margie.
Morning, Margie.
Okay, I think that was everyone. Good. Okay, well, let's go ahead and get started.
Great. Thanks a lot, Kelsey, and thanks for just taking the time. As I get started here, I just want to point out I put my contact information in the lower left-hand corner, and I just wanted to do a quick roundtable just in case, if there's anything that I can do as we go along to support, feel free to reach out to me, give me a call, or email me anytime. So I just wanted to, get introduced to everyone. So let's hop into it. So what I am hoping to cover in the next hour is I want to give you a little bit of introduction about the project. As Kelsey mentioned, the dashboard component that is in the EMR, in the Wolf EMR, is net new. So for those of you on the call that have already been working with some access clinics, they've had that feature for some time. So again, it's a new feature in Wolf, so I just want to give a little bit of context around that because your Wolf users will not have any experience with it yet. And so in line with that, I want to talk about just shortly about what we call the IPTO framework. It's how we organize the dashboard, just so that you're aware. And then we're going to get into the fun stuff, which is, of course, the reason why we're here today, the PSP panel management dashboards. So we'll cover those. And I also want to walk through some data cleanup and best practices in the EMR, which go hand in hand with the tools. And of course, we'll have some time for Q&A. And as Kelsey mentioned, feel free to ask questions along the way. So a little bit more just about the PSP Panel Management Dashboard Initiative. The design here is to support clinicians in monitoring and managing. We have 17 conditions. So 17 condition-based populations, so panels, which I'll get into. In addition, the tools allow physicians to take insights and take action on those patient lists. So they can drill down and see the patient lists from the dashboards and take action to do some data cleanup. And in addition, I'll get into this a little bit further, but they're actually able to share their statistics, which will equip you to support them better, so you can actually be equipped when you visit them. And in return, they receive an aggregated average of all their other participating peers. So it might not make sense till I show you an example, but really looking at a dashboard that shows a number of prevalence indicators for a number of conditions, they can not only see, what the information in their EMR looks like for their patients, but they can also see, what's the prevalence across the board of everyone who's participating. So it's a little bit of added value when they share their data so that you have a better way to support them. Okay, and Kelsey, if you want to add anything to the project goals, I just have more of the technical pieces here, and that is for this pilot, we are going to provide this tool set to 200 physicians in total, and that's across the Wolf and MedAccess EMRs, so roughly 100 with each EMR. And the second component there is what I already alluded to, which is a sponsored dashboard viewer, which is separate to the physician EMRs. It's a tool for you RSTs to be able to log in and see the progress and data of the physicians who are participating. So just a little bit further, if you regularly visit a clinic and have to run through a number of reports to kind of assess and see where they're at, if a physician chooses to share their data, you're able to log into a separate space and see that data before you actually visit the physician. So it just helps you prepare, it helps you, track progress and your work together.
That's great, Pierce. Thanks. I'll just add that before you guys, everyone panics and goes, this is exciting, but what does this mean? We have scheduled, you should have received an invite to another meeting next week, I believe Tuesday, that will actually take a deeper dive into your regional support team viewer dashboard, what that means, what it looks like, what you'll see, questions about how to, access a baseline versus data from that day, things like that. So before you kind of panic about, oh, I have a million questions around that, we will have some dedicated time next week to take a deeper dive into that and answer any questions you have about it. And we'll also be providing you guys with, we're working on sort of a one-pager sort of a FAQ, if you will, that will help you with some common questions and some key messages so that you can feel prepared to answer when you're in the practice and the physician is asking, what does this mean, what am I sharing exactly, and so forth. So just rest assured we're trying to put something together so that you have the information you need to communicate to the practices.
Absolutely. Thanks, Kelsey. Yeah, and I'll just add to that for today, well, we're just going to be talking about what's in the physician EMRs. So what is going to be available to doctors and what are they going to see in their environment. So just to give some information around what that actual outcomes dashboard component is, again, in Wolf, it's a net new feature. Okay, and what it is, it provides aggregated graphical data in their EMR. So a lot of the things that doctors would have had to go into their practice search area to run manual reports, perhaps they were building reports. What this does is actually takes a set of reports and provides a graphical display of it. So a visualization, which makes it also a little bit easier and quicker for them to access that data. Okay, it also enables clinicians to quickly action these reports. So I'll show you as we get into the demo, but you're actually able to click on certain sections of pies and tables and reports and actually obtain up-to-date patient lists. Okay, so it puts clinicians in control of their data. And as we talked a little bit about sharing their data will also give them a peer average, and they are in control whether they'd like to share their data or not. So we'll talk about that a little bit further. Any questions so far? Okay. So building upon that new feature, we're building the panel management dashboard for this PSP initiative. And what we have here is, again, it's still the same space. It is a data visualization tool. In this case, though, we're covering 17 prevalence conditions, okay? And that's going to be separated over 3 different dashboards. So again, they're going to be able to share their dashboard. They'll have a prevalence tile for each condition. Okay, and that will be these little pie graphs that you will be able to see here. And packaged with each prevalence tile, showing, how many of my patients have a certain condition, there's going to be a consider tile, okay? And it's a little bit harder to see here, but it's actually bringing, identifying patients that may be suspected of that condition based on a number of different pieces of data on their chart. Okay, so patients that aren't currently diagnosed with a condition but may be suspected of having one, we're also going to be bringing that data to them. So letting doctors see, who is suspected and take action on those charts. Okay. And because we're covering 17 different conditions, a lot of great resources packed there, but in order to make it a little bit easier to digest, we've broken them down into 3 different dashboards. Okay, so instead of having all 17 prevalence conditions on one page, it's going to be broken down into 3. And when we're started here on the project, we're activating the panel 1. So there's a number of conditions there that will be the first step. And we've just found that this is also a little bit easier, digestible for your first visit to start on some of these primary conditions. So I'll take a quick moment here and just talk about the IPTO framework. Okay, so Telus Health, when we've designed this new dashboard feature, the number of reports that go up in the dashboard space, we've broken down into 4 different categories. Now, the important thing to remember for this project, all we're considering is the identify piece, that first of the 4 different categories, but I just want to let you know about the other 4. In case, physicians are aware of the feature, and just so that you can speak to them if they do come up. Okay. So I will give you the Coles notes here. But identify is a phase of establishing accurate patient registries, okay, so or patient populations. And that's what this initiative is all about, being able to identify, your patients with certain conditions and being able to update your patient populations. Identifies those patients that may be suspected of a condition and making sure we correctly document that on their chart. So that's really what identify is all about. The next three phases, which again are not a part of this project, process is a little bit more around engaging patients within those accurate populations. Okay, being able to, put in place a process with those specific patients that you've identified. Okay, so that may be recalling patients with certain conditions, something like that. The third is tool use, so that's, using guideline-based tools with those patient populations, okay, for improvement of care. And the last one is outcomes, packaging all of those 4 steps together, identifying patients, applying a process, using guideline-based tools. The fourth is being able to track the actual impact of that process, so being able to see actual health outcomes. So while, I'm giving you more information than you need, this is kind of the picture on where the tool is headed. But for this project, it's really important and vital that we're focusing on that identify piece and understanding the value that comes down the road when we focus on this identify piece. We make sure that, all of our patients who are diabetic are correctly diagnosed and documented that way in our EMR. So lastly, I just want to break down, again, the 3 different dashboards, the ones that are going to be available for the Wolf EMR clinics right out of the gate is the panel 1, so our primary dashboard, which includes a report on your active patients, some polypharmacy information about medications, and then the conditions that we're covering is diabetes, heart failure, hypertension, COPD, and chronic pain. Now you can see the other 2 dashboards will be coming, but again, that first dashboard will be our starting point. Any questions so far? Okay. So let's hop into the actual demo. I will log into our Wolf system here. So here we are in our Wolf EMR. And before I get started, I might just ask, anyone on the call today not been in the Wolf environment before? Okay. Just wanted to check, if there's some of you on the call that have a little bit more experience or less, feel free to just, if you'd like me to clarify anything, just please let me know as we go. So here we are on the Wolf EMR on the main page, and what I'd like to show you, of course, is how to get started. How do we access that new outcomes dashboard feature? Because you're probably going to be speaking with physicians who have never been there before. Okay, so to get started, here we are on our home page. We want to go to the Reports tab. Okay, Reports tab in the top left-hand corner. And right here, okay, we have an Outcomes Dashboard button. Okay, and this wasn't here before, so, but this is the space where physicians and clinics will go to run reports on their clinic, if they've got some built in. They just may not have seen this button before. So I'm going to go ahead and click this. Okay, and what it does is it launches a new window. Okay, let me expand that so we can see it a little bit better. And this takes us to the Outcomes Dashboard feature. We're not yet at the PSP dashboard. So what this does, again, it's a new window, but what it's doing is it's pulling data from the EMR and it's displaying it to us here in a graphical display. Okay, what we're landing on here is the main page in the Outcomes Dashboard, okay, which just gives a number of clinical information and insights, and this is what every clinic will have as their landing space, okay? So, just to give you a little bit of background on this, we do have one for patient status. Okay, and this is actually just looking at, all of your patient data and breaking it down. So you'll see in the top left-hand corner, I do want to show you provider, because when we log into the dashboard, it's logging in for the provider that's logging in. Okay, and it's showing data for that specific doctor. So we're not necessarily looking at everybody in the clinic, but we're looking at all those patients that are attached to the provider who's looking at the dashboard. At any time, they can change this to look at other doctors in the clinic, but the default is, of course, to show a physician their patient population. Okay, and when we have that set, we know that all the reports are pointing to that doctor's patients. Okay. So I'm not going to spend too much time on the home dashboard, but I just want to show you what it is, that it is our landing space. To access additional dashboards, up in the top right-hand corner, there's a View All Dashboards button. Okay, from here, when I click on this, it's going to give you a menu of all the available dashboards. Now, I'm in a demo environment, so I've got a number of, test things up here. It's not, when you're in clinic, you're only going to see a few options. The ones that you will see are the Practice Support Program Panel 1, Panel 2, and Panel 3. Okay, so I'm going to go ahead and select Panel 1 to get started. And I just will mention, I'm in a QA environment, and we had our server reset last night, so not all the data that I had set up is showing. I will hop back and forward to another example just so you have a good understanding of what you'll see when you're in clinic. Okay, and I just see we got a question that popped up. What if a patient is not attached to a primary provider? Great question. It's important that patients do get attached to a primary provider. You can actually look at that in reports to identify, which patients out there aren't attached, and you can attach those in their actual demographic space. So I'm going to talk about that just a little bit further. So Audrey, thanks for the question. So before I get to that, though, I just want to talk a little bit about the layout of this dashboard, and I want to focus on the functionality of sharing. Okay, so in the top left-hand corner, I will first point out this little gray icon, and this is a favorite icon. If you've logged into this dashboard and you're planning to come back, which we hope you will, I highly recommend that you click this little gray icon to make it as a favorite. When I do this, you'll see it marked as a favorite, and let's say I hop back to my home dashboard. Okay, you're going to see now Panel 1 is now on my toolbar going forward. So just to save you time, you don't have to always click down in your actual All Dashboards list. If you mark something as a favorite, it's going to list there for quicker access in the future. Now, the second differentiation is sharing. Okay, so you'll see on that home dashboard, there's no sharing technology. There's no sharing option in the top left-hand corner. I will show you when we're on the PSP dashboard. Okay, you'll see that there's an actual share these metrics with a practice support program. Okay, so as I talked about just a little bit earlier, sharing metrics is up to the physician to choose if they like to share their metrics. And when they share, they're not sharing patient data at all, they're just sharing the numbers. So just the metrics, all the patient data is not considered. And those metrics get shared with the sponsor tool, which we're going to talk about next week, which is a space that you can log into to see how everything looks, to see those prevalence numbers, to see how it's changed over time. So that helps you be a little bit more prepared before you go into a clinic. It also helps you support the physician ongoing. But before we do that, we do just want to make sure that the physician wants to share and authorizes it. So they can click here on the share folder. And what that does is expand sharing preferences. What we're looking at, okay, is all the different sharing pieces on the dashboard, really, all the different reports And on the right-hand side, it's showing available since. So how far back is the data available in the EMR? Okay, so you may have your EMR for 5 years, but the data is available to share only from the date in which you get the dashboard feature in your EMR, if that makes sense. You can see January 19th is the earliest date in which I can share data, and that's because this EMR only got the dashboard for the first time on January 19th. Okay, when I scroll to the bottom, important piece to talk about is the terms of sharing. So by sharing, physicians consent to the terms of the practice support program, and we can click on that to look at it. Okay, and we've put this wording here just so doctors are absolutely aware of what the data is doing. Is that me or hearing the music alone?
No, I hear it too. I'm just trying to figure out where it's coming from. I'm going to mute them. There we go.
Thanks, Kelsey.
No problem.
So here we are taking a look at our the terms of sharing. So this is where we outline the actual terms, and we want to be really clear on what that data is being used for. Again, patient data is not being shared. It's just the statistics, okay, and what is that data being used for? Okay, so I think this is a really important piece to step through with physicians. All right, and those metrics, again, would be used to support individual physicians or clinics with their own metrics. All right, also help improve the initiative, you know, and inform the development of new quality improvement initiatives, so being able to see that data. Okay, and then the third piece that data would be used for is peer comparisons, okay? So when you share, you get to see the average of all other peer comparisons. So I'm not going to be able to see other doctors' information, only the average of everybody sharing. Okay, and by sharing, you accept the above terms and conditions. Okay? I'll close that down. So once we've read those terms of sharing, you can then share, and there's two options: from the earliest date available, and that's this one in the right-hand column, or from today going forward. Now, I highly recommend that we share from the earliest, because that also helps us track on our sponsor view or how things have changed over time. So again, it's up to the physician, but it does help you, the RST, support them better if you're able to see more information. So I'll go ahead and click that from earliest. Now, Audrey, I see I had a question pop up there. I didn't catch the full question, so if you want to unmute and ask, feel free to do so, or please send that message through one more time.
Hey, Pierce, I was just wondering, without sharing, you can still see the other docs in your EMR's data though, right?
Yeah, that's absolutely right. So when you're looking at the dashboard in your EMR, you can look at your own data. That's the default. You also have the ability to look at other doctors in your clinic. So the permissions is still the same as running manual reports in your system. You know, a doctor could run a report and look at another doctor in their EMR. The difference with sharing is that the peer comparison that shows up, okay, is from all other participating physicians. That's not just at your clinic, but that would be all doctors, you know, maybe across the province that are sharing. So it's not just a peer comparison of those in your clinic, but all those doctors out there who are choosing to share as well. Okay, and the second important piece is you can absolutely see the data and trend data when you go into the EMR, when you visit the doctor at their clinic. But if they don't share from here, you won't see their data in the sponsor viewer, which again, we're going to talk about next week. So, you know, I think the biggest value is being able to share so that you, the RST, can better support the docs. I know just from my own experience, you know, years ago working with MedAccess in training, you know, I would spend an hour before every session with the doctor just to run reports and see, you know, what their data was, just so I could provide those insights. And I know for a lot of you who didn't even have the access to the systems, those are reports you'd have to run and look into when you're there with a doctor. So another way to think about it too is, if you're able to look at that before you visit, you can also be a little bit more efficient with the doctor's time and also be more prepared. So I do think there's real big value for the physician to share in this case.
Hi, Pierce, this is Sophia. I have a question.
Sure.
Sorry, I missed your comment about the reference to sharing at the earliest possible date. So earliest possible date.
So yeah, let me head back. So let me show you this here. What I'll do next is stop sharing. So I'll just, before I answer your question, Sophia, I'll just talk a little bit about stop sharing. At any point in time, we can click that. If a physician wants to stop sharing, they can. Okay, when I click on that, you'll see that that folder goes yellow again. It's no longer gray, and we're no longer sharing data. So at any time, doctors can stop sharing, but it does not recall the data that they've shared already. So going forward, no more data will be shared, but whatever they have shared doesn't get recalled. So Sophia, I'll answer your question next about from the earliest. So let's say we decide we want to share. This date here, available since, is really the earliest date that data can be shared. So if I went and clicked from today, again, it's just going to take data from today going forward. Okay, so start sharing my data on a daily basis. I don't need to provide any maintenance there. It just does it automatically. If I wanted to share, yeah, absolutely, share all the data, that I can, I would click from earliest, but it would only share data as far back as this date here, the earliest date available. And just for, maybe some technical explanation on how that works, the reason why the earliest dates may not be as old as your EMR is because it's only collecting data from the date in which that dashboard feature was turned on in your EMR. Does that make sense?
Yes, thank you very much. And the second question was, just to clarify, who can, once they choose to share the data, is it just the RST that sees data, or is it PSP Central? Like, who has access to that data?
Yeah, that's a great question. So there is the sharing dashboard, is a PSP dashboard, and Kelsey, you can step in here. I know Kelsey will have an account, but it is a PSP tool. The design, though, is that we give login accounts to all the RSTs that are involved. So the tool is primarily for you, the RST, but it is a PSP a tool.
Thanks, Pierce. Yeah, guys, to be totally honest, this is such new territory and it's all very gray. So yeah, like Pierce is right. I have like an administrator account, so I could log in, but we're just working through like the language right now and the options. We want to be really clear for physicians to understand options, and so if they haven't consented, we will not be like accessing their information, but we will be asking. And the purpose for that, and again, you'll be supported with this, to have this language in writing, but the purpose for that is not actually to go in and like look at individuals. We're wanting to monitor it from like a pilot perspective and look at what is the impact or the value of having participated in this kind of work and in this process, looking at both the tools, so, like the value of using the Telus Health dashboard, the value of your added, all the experience that you bring around the coaching element, like is this worthwhile for doctors and their time? So just to be clear, we will be asking them if they consent, do they agree to share their information? And if that's the case, we'll actually be working more through you to get scores, and that will be anonymized. So it's less important to me to understand how your individual physicians are doing, but more that I can see just general anonymized information about the impact of this work. So more to come on that. I totally appreciate you're going to get these questions, and it's going to be complicated, so we're trying our best to get something in writing. It's been floated through your team leads, and it's now being looked at by doctors of BC Legal Counsel just to make sure that we're adhering to all ethics policies and everything like that, because there's some slightly different nuances when it's kind of being used at the health authority level, so like your level, versus the PSP central level, because we adhere to doctors of BC ethics policies and privacy standards. Again, the reason that it would ever come back to doctors of BC, PSP central, at the doctor's consent would be for the purpose of evaluating and improving the pilot. So we're working on that language. It's sort of with the powers that be right now, and we're going to try to get something out to you as soon as possible so that you feel, you know, informed of having these conversations.
Thank you for the explanation. And just to clarify, when you said the RSTs have access, so that means I, as an RST, have access only to my doctors, correct, as opposed to a doctor in Northern Health data dashboard?
So what you would have as an RST, you can log in to that separate space, which essentially is like this view. You don't have access to patient data or patient lists, but you can choose the doctor that you're working with, and that will load their information for you. Yeah.
And that needs to be, that only happens when the physician has opted in as well. So the physician, there's a step. Again, we're going to cover this in more detail. I think it's Tuesday, and I really hope everyone can make it to that, because I know there's going to be a lot of questions about this. And for the purpose of the pilot, the physician has the complete choice. They do, you know, they can still do this work, engage with you, and be paid for it, and decide not to share. But I think the real benefit and the way we need to frame it and come at it for the physicians is, you know, your ability to see this information before going in to these kinds of meetings really helps you prepare, and ultimately helps you guys use your time more efficiently. So it's really selling them on the value of the efficiency and the kind of optimizing, you know, your time together. But again, we need to work through that language and make sure you're comfortable with those key messages.
Thanks, Kelsey.
I don't, if we have time at the end, not that I want to pick on her, but we've got Erin Lutz on the phone and Mai Bennett, who are actually working with a different, it's the same technology, but a slightly different version of a dashboard, looking at different metrics in their community. And I believe that they're starting some of that work now. And so if we have time at the end, maybe Erin and Mai could call in you guys just to share a little bit about how that's going, and you know, some of the questions that you're being asked, or how it's maybe, I think even more, I'm just curious about how it's changing your own sort of processes and how you're preparing for meetings or using your time in practice. But let's continue on with the rest of the presentation, Pierce, and then if we have time, maybe we can open it up to Erin and Mai.
Okay, thanks a lot. So now that we've talked a little bit about sharing, again, we'll talk about more with the sponsor dashboard next week. I also just want to show you this welcome tile in the top left-hand corner, and this is just the welcome space. Okay, it gives a little bit of information, which we've already covered, but what the program is about, you know, what it's designed for. Okay, so just to give physicians a little bit more information about the initiative. Okay, and the option of sharing is included there, and a place to go if they like more information. Okay. Now we'll talk about a little bit of the functionality of the dashboard. Here's some of the fun parts. But as I mentioned before, again, these are interactive graphs, okay, and pie graphs, and we can hover over those, and it's going to give us information. Okay, at any point, too, you can click down on some of these options, which will generate a patient list. Okay, so let me just click on one here, and you can see it actually brings up a list of all patients in the Wolf EMR that match that criteria. Okay, so when we get started, the first one is not a prevalence indicator, and there's a reason for that. We're looking at active patients. So when we're looking at the rest of our prevalence indicators, so, you know, how many patients are hypertensive, you know, it's showing me I've got 9.5% in my demo environment. But the patient status is important because all the other indicators that we're looking at is looking for active status patients, okay? So just to make a clarification for those of you who work in the MedAccess, EMR, and Wolf, Wolf can have a number of different patient statuses, but as long as they're not inactive. Okay, so we're looking at all patients that are just not marked inactive. Okay, so it's important to take a look at your patient population, because if I've got a number of patients that I haven't seen in 5 or more years, they're contributing to the rest of these indicators. Okay, so again, these are looking at only those patients that are not inactive. So we got to make sure, or it's a good practice, maybe I'll word it that way. It's a good practice to take a look at your patient population, decide, are there some patients out there that shouldn't be part of my active patient population? Okay, so we've developed this tool just to help physicians take a closer look. Of course, it's always up to the physician, which patients they'd want to consider as a part of their patient population, but we've broken it down into a number of different slices. Okay, so we're first looking at, all of my patients that we've seen, so all the patients that are attached to me as a provider that I've seen in, less than 3 years. So that's that large green slice of the pie. The next is, how many patients we've seen in 3 to 5 years, how many patients have we seen, that we haven't seen in the last, 5 or more years. And again, the last one is, how many patients have we never seen at all? And really what that's looking for is, how many patients do I have attached to me that I don't have any encounters, any visits with? Okay, and that may be because you've had a lab result that you were CC'd on and it generated a chart in your EMR. It could be a number of reasons like that, but it's just, it's a good piece to go to take a closer look. So if a physician would want to decide, let's say, I only want to consider patients that I've seen in the last 5 years a part of my active patient population, we could click into, patients that we haven't seen in, over 5 years. And I'm going to click on that to generate my patient list. And we could go through and check through these charts. If there's some patients that we actually want to mark as inactive, we could do that. Okay, so at any time with these patient lists, you can double-click them to launch the actual patient chart. Okay, and there's got a little bit of delay. I'm remoting into a Wolf environment, but again, it's going to load that patient chart for you so you can take a closer look. Maybe there's a reason that you don't want to mark them as inactive. Okay, so it's a good practice just to quality check these. Yeah, let's close that down. And you could go into the demographic space and mark each one inactive if you'd like to, or inactivate them. But you can also use it through a bulk services tool. So let's say we wanted to select all of these. You can hit Control-A, okay? Or if you want to deselect all, we can go ahead and hit Control-D. But I'm just going to do it on 3 charts just to demonstrate. To save you time, what we could do is, once we've selected the charts that we want to take action on, up here in the Selection drop-down, there is an option to update patient status. So when I scroll down to that and click on it, it gives us a number of options. The first one is the actual status, and again, I can select what we'd like to do there. Okay, and maybe you want to write left practice. And again, we can append a note to this. So that actually appends a note to each of the patient charts. So you can say, let's say if the doctor decides, chart as they've not been in the last 5 years. Okay, you could put in a note there and put in an end date. Maybe we'll say today. Okay, we could go ahead and click OK. Oh. Okay, and it'll go ahead and update those charts for us. Now, I just wanted to show you that feature. Again, it's not something you have to do as a physician, but it's something to consider, because the rest of their prevalence tiles are looking at their active patients. I just saw the question pop up, what is the start and end dates? So there's a start and end date to an actual patient status. So if you're inactivating someone, there needs to be a time period for that patient status. So usually when you get a new chart, most charts that you're going to be on already have a start date on them. And when we create a new chart, it's going to have a start date. And when you're ending that status, you would just have to put in the end date. Again, just because I'm in my QA environment here, not all my charts have that start date on there, but you would expect to see that there. Now, let's get into the actual prevalence indicators. So I'm going to start off just taking a look at diabetes prevalence, okay? And what we're looking at here, again, is for that provider, we're looking at all of the patients that are attached to them. So we have two segments. We have those patients that are currently diagnosed with diabetes. And it's important to know that we're looking at patients that have that ICD-9 code of 250 documented in their problem list, okay, in comparison to all my other active patients. Okay, so at any time we could go ahead and click on that. So let's take a look at our diabetes, and if you want to double check, okay, I'm going to open the chart. And you'll see here in my problem list, I do have diabetes listed. Now, this is an odd one, but the ICD-9 code is starting with 250. Okay, so I just want to show you how you could quality check to verify. As well, at any time, we can hover over in the top right-hand corner of these boxes. And if you click this little help icon, it's going to tell you and take you to the help documentation exactly what we're looking at. Okay, so for all of these prevalence indicators, we're looking at patients that have the actual ICD-9 code or equivalent SNOMED documented as an active problem on their chart. And that will go the same for every single prevalence piece. Now, packaged with each prevalence indicator is going to be the consider tile. So this is the tile that provides quite a bit of value to doctors because it's going to bring up charts that may be suspected of having conditions. Now, I'm going to hop over to just a different environment because, as I mentioned, the data wasn't showing up as I hoped today. So here's an example of the dashboard as it'll look for you when you go in to visit doctors. And with each consider tile, there's a number of options. So the first is that condition has been documented as text, but not coded with that correct ICD-9 or SNOMED code. Okay? So you can see for, heart failure, I'm seeing one match of a patient chart. And we could click on that to access the chart and take a closer look. Okay. The second would be, have we billed that patient with that ICD-9 code at least 2 times, but we haven't diagnosed them with that condition in their problem list. So this may, alert you to drilling down and taking a closer look, saying perhaps maybe we do need to add a problem list for that patient or not. And again, have we had a visit or encounter where we've put the diagnosis of diabetes or that condition in, but we haven't yet documented it in their problem list. Okay, so those first 3 are really focused on data that we've entered on the patient chart. The fourth is always going to be something a little bit more clinical. So if there's a lab result or, some other data that indicates that we may have a condition, that's going to be the fourth one. So for diabetes, if we've had a lab result of hemoglobin A1C or a, glucose fasting results greater than 7%, it's going to flag those patients so we can take a closer look. Okay, for something like Hypertension, you'll see we're looking for blood pressure, greater than 140/90. So this is real-time data. If I look at this data, it's showing me all those patients that match that criteria. What happens tomorrow if a patient got, a BP result in, we'd be able to see that popping up on our dashboard tomorrow. So the value here is it's giving us up-to-date insights about our practice and our patient populations, and also gives us that opportunity to drill down and take action to update the information. Now again, I'm showing you this example from my MedAccess window. It looks exactly the same in both EMRs, but you'll see if I had clicked on one of these, it's going to bring it to the MedAccess window, not the Wolf one. So let me demonstrate that from the Wolf environment. Any questions so far? I do see some of the questions were popping up, but I apologize with my window. I'm not able to read those. They're a little bit cut off on my screen.
Where do the documents text but not coded query search?
Yes. Yeah, great question. So I'll walk through those where those are documented now in the EMR. The reason why I didn't drill those down just because the data in my Wolf environment isn't there. So I was showing you an example of what the dashboard looks like in a different EMR. They're exactly the same, but I just wasn't able to drill down. So let's take a look at what those are. So let's take a look at, I'll take a look at diabetes here. I'll just select one that will have a patient, and I'll walk through those with you. So let's go ahead and open up a patient chart. Now, the ones that are looking for have we documented as text but not coded. I will tell you, for all you on the line, if you're visiting a Wolf clinic, I doubt we will see a lot of those in there. One of the really nice things about the Wolf EMR is that when you enter a problem, it's always associated to a code. Okay, in MedAccess, for those of you who have a little more experience on that side, you'll know that that's all a manual process. In MedAccess, they'll have to create their own templates that show up. So it's more likely that that text but not coded will be something to consider for your MedAccess users, whereas Wolf, it won't be as much as an item. But it is a possibility that you will have these because it is customizable as well in Wolf. So there is a chance that, someone maybe created something, years ago that's been in use that didn't have a code associated. So I'll show you where that is when we're up on the patient chart. Okay, I'll just walk you through the steps in case you haven't been here before. But as soon as we look at the patient chart, you can right-click. There we go. Apologize. Once we click, sorry, it's F9 will bring us to the patient summary. Oh, that's why. No patient selected. Here we go. So once we open that patient chart, you can go to the medical summary. Okay, right-click anywhere in the window. You can click medical summary. Or, as you can see, the shortcut is hitting F7 on your keyboard. Okay, that takes us to our patient's medical summary. And you can see right here in the top right tab, current history, that's what we're looking for in our problem list. So this really is looking at what is documented as a current problem on the patient list. So you can see that's everything that's there right now. Okay, if you needed to add a new problem, here's the manual process to do that. A physician would click on Add a New Problem. And here's our window to document additional conditions. You can see right in the top here, select diagnosis. Let's say I was going to add hypertension. Okay. I could either go ahead and just type in the ICD-9 code and click Enter, and it runs a search and shows us all the ones that are in our system. And again, that's the nice thing about Wolf is that it's always paired with an ICD-9 code. So again, if we had one documented as text but not coded, you would see someone had hypertension in here but no associated ICD-9 code. It's not very common, but it's just good to know. Okay, so I type in hypertension again, so we can search for the code or for the text description, and it'll pull it in here. So let's say I'll select this one here and click update, and there it is in my problem list. Okay, so that's a manual process. Again, you'll see that ICD-9 code, I didn't need to worry about it. It automatically pulls in for us. Okay. In line with talking about some of the manual processes, if we had launched a list looking at, patients that have an encounter that's diagnosed, okay, let me just close this window here. So I'll click the Save and Close button. Okay, right next to the actual problems is encounters. So you can actually see here all of our past encounters. Okay, so that's where we can see that information. If we had clicked on a list, of patients that have a high hemoglobin A1C but no problem list for diabetes, when we're in this space as well, you can review labs in the investigation window. Okay, so all your labs would be listed here. And then the third one that I want to mention is bills, because again, it is looking for bills that are, let's say we had 2 bills for diabetes, but we haven't documented it as a condition in the problem list. Again, you can right-click to access this, but going into the patient maintenance area, okay? We can also click F9. So right-click, view patient maintenance, or you can hit F9 on your keyboard. Okay, and that takes you to the patient maintenance space, and their billing is located up here in the billing tab. Okay, so you can see the past history of what's been billed. So you'll see not only, what was billed, but the actual ICD-9 code. And I apologize, it's showing Alberta data, but we are, in our case, we're in BC. Okay, so those are the manual processes of doing it on a chart, which is good to know. But one of the value, of course, of using the dashboard is that you can apply services. So in the same way that I had applied a service to change patient status, we can also do that to add problems. Okay, so let's say, again, on this one here, and I'll give you before I do that, I'll just show you what it would look like again. For hypertension, you'd have a number of different indicators. But let's say we wanted to apply a hypertension problem list item on patients. We could drill down into that and do that. So let me give you an example. In Wolf, I'm going to go ahead and click on that. It's going to generate the patient list. Just give it a moment here. Okay, so we're going to have 58 patients in our window. Again, it's showing at the bottom we have 58 matching patients. And I do encourage you, to double check, so the physician will say, yes, I would like to, document hypertension on these charts. Again, we could select all, select all or deselect all. Maybe we've gone through these and we only wanted to update it on a few. I'll just select a couple just for example. So instead of doing that manual process of adding a problem list on each specific chart, of course, click Select, and before we did update patient status, this time we want to apply a problem list. So Add to Problem List. Now when I do this, it'll pop up a problem list item, and here we can do that same process of typing in either the code that we're looking for, or we can type in the condition. So I'm just going to write hypertension, click Enter, and you can see it already pulls up a match below. Okay, so again, we can select any of the matches here. Okay, so I'm just going to select this one here. Click OK. And there we go, 5 patients successfully updated with the selected problem. Now you'll see if I go ahead and click on this patient that we just ran that, I can do that same process. Here we are on the patient chart, current history, and you can see that got added to the problem list. Okay, so that's just how much faster the tool makes that data cleanup. So before, if you were to run a list and you're going through different charts and you needed to manually do this, with the dashboard and the patient list that pops up, we can actually just apply the services to make that a little bit quicker. Any questions so far? Okay.
Pierce, sorry, I just wanted to, it's Kelsey, I just wanted to mention I am monitoring the chat, and there's been some just correspondence just to me about some things, but I'll let you know if anything, any questions come up. I will let you know.
Perfect. Thanks, Kelsey.
So if you're seeing action, it's just been to me so far.
Okay. Yeah, perfect. Thank you.
Hey, Pierce, I know that dashboards are new to the Wolf users, but if users are interested and confident, are they now able to create their own dashboards separate from this project?
That's a good question. So the dashboard feature is not editable. So these are pieces that we hard code in. So doctors aren't able to copy and change these dashboards. And I'm assuming if you've been working in MedAccess, there is a dashboard feature in MedAccess where you can create your own. That's not in this space. And you will see, for those of you who are in the MedAccess environment, they are different spaces. So when you're clicking the dashboard button that has this little globe icon, you're coming to this fixed space where we've got these set reports in place. I know it's something that we've had asks for rather, but at this point it's not editable.
Pierce, this is Jo. Just to add to that, I'm just wondering, can you add to the criteria, the search criteria on the fly if you know that, a physician, for example, is coding something a certain way that this particular report is not looking for? So
yes,
you can do that in MedAccess. So I'm just wondering if you can do that here.
Yeah, great question, Jo. Thank you. So the short answer is yes, you can. You can do the same process. It's just a little bit of a different workflow. So for those of you who have been in the MedAccess environment, when you click on a patient list, it also shows the criteria that you can kind of change to do, on the fly. So as Jo mentioned, maybe we're looking for maybe a physician documented it somewhere else, somehow differently. You can find those charts and apply the correct problem list. But from this space, you're not actually seeing that criteria. So let me show you how to do that. I'm going to close this down. I'm going to minimize our outcomes window. There we are. So here I am back in the, didn't minimize that, there we go. Here I am back in the Wolf environment. And if I go back to our home space, and I apologize, it looks like we got just a little bit of a lag here. There we go. So from our home space, there is a practice search option, okay? So when I click on practice search, this is that equivalent to the MedAccess practice management area. So it's just a place where we can do searches on our patient population in our EMR, okay? So what we have on the left-hand side here is a number of search parameters of what we're looking for. Okay, and on the right-hand side, you can make some selections. Okay, so you could build this manually as you go. Just for those who haven't been in this space before, I'll give you just a simple example. You know, you can look for some demographics. You know, patient age is between. You know, gender is. You know, you can add some pieces like that. There's some additional pieces you could look at. You know, do they have a certain ICD-9 or SNOMED code, right? And that pulls in. So this is a manual process. You can select different options and look for them. You know, let's look for all those patients that have diabetes. You know, I could click that in here. I apologize, my system is just running a little bit slow. There you go. So again, you could continually go down this list. We could pull different observations in that we want to look for, and in the very top, you can generate a patient list. And this is going to be exactly what you see when you're launching it from the Outcomes dashboard. Okay, so again, that same view, same options. It's just not, you know, you don't see this piece when you're logging in from the actual dashboard. Okay, so this is what, you know, maybe a lot of you visiting have had to do. You've had to come into this space, build a report, and look for certain criteria. Okay, but the handy thing that we have here, I'm just going to remove these pieces, is at the very bottom. I'm going to minimize this. There's a section called predefined queries, and this is the important part for us. You can see that there will be sections based on the dashboards that are available to them, okay? And so what you will see is PSP Management 1, 2, and 3. But let me give you an example. Click in predefined queries, and it's going to show you all the different items on that dashboard. Okay, so unfortunately, just in my demo environment, I don't have the PSP1, but PSP2 we're looking at here, and this is a number of the reports that are available there. Okay, so every single report that is being considered in the dashboard is listed here. So here's a simple one, prevalence, all of our osteoarthritis patients. Okay, and then I could just run a quick search. Okay, so what this is doing here when we're looking at predefined queries is it's just showing us the same information that's on our dashboard. It just doesn't have that graphical representation. So Joe, if you wanted to look for a patient that had, you know, text but not coded, or you want to look for something else, you could build on top of that. So of course you can change these on the fly by pulling something else in. You know, perhaps they had something documented in one of their encounters or exams. We could actually look for that. Okay, this is a little bit more complex, but it is an option to you. And if you're working with a physician that, you know, is going through this with you and says, oh, that's great, but, you know what, I think we did this, you know, together you can go here and look for that. If you do have any questions, you know, as you go along, if there's something you couldn't find, or feel free to reach out to me. I'm happy to help. But I think that's one of the big values of the dashboard, is it takes away some of the technical pieces of having to manually look and search and find. But of course, at any time, that option is available to you.
So Pierce, is access to these dashboards based on role-defined privileges?
Mm-hmm. Yeah, absolutely. So the dashboard is accessible by everybody in the EMR. So the permissions that you have as a user matches the permissions that you have in the dashboard. So I know in the MedAccess environment, there's some user permissions that if, you know, some users don't have that ability to apply services. So that bulk process of applying problem list items to a number of patients. Some users might not have that. But all physicians will have the full set of permissions. So I'm assuming that when you're working with doctors, that's who you'll be working with, or perhaps an administrator at the clinic. But
so could a support staff, either an admin or an MOA, look at their physician's dashboard on their behalf if the physician was hoping for them to pull lists? And
yeah, absolutely. So one of the pieces that, you know, we're asking doctors when we sit down with them is, you know, is there someone at your clinic that you rely on with this information? You know, so if there's an administrator at the clinic that it's going to be part of their role to help support and take a look at this, absolutely. They'll have the same permissions. They'll be able to see the same information. So they're absolutely able to be a part of that support process, if that's what works best for that clinic. The only piece that, you know, when I say the word clinician making these actions, is I just think it's good to let them take a look and let them make the decision on, you know, what needs to be documented as a, you know, confirmed diagnosis. But of course, if we're working together, you know, in a team-based approach, there's an administrator that wants to bring these to their attention. Absolutely, yep. So we do have that flexibility. Any questions so far about some of that functionality that we've been talking about? So I do realize that we are just past 10 after. I do want to talk about some more fun features just on how we can look at the data. So I'll move on to that in case there isn't any other questions about some of those functionality pieces that I talked about.
Nothing on the chat line right now.
Great. Okay. So what I'll do here is, pardon me, I'm just going to launch the other view of the dashboard. Here we are. So I just want to show you on how we can use this tool. Not only, we've talked about how we can use it to update our patient populations and create some accurate documentation, but how do we use that dashboard to look at this information in a more meaningful way? So I did show you, of course, we have those graphs that you can hover over and click on. But there's some other pieces we can do too. When I click, or hover rather, over the menu button in the top right-hand corner, there is a trending graph here. So when I click on that, it turns my pie graph into a timeline. Now again, the data here probably isn't as interesting in my demo database, but what you actually see now is that data over time. So if you're working and supporting a physician, you can see the change of that data over the course of your work with them. Okay, so again, it takes those two segments. Okay, it takes all of our patients that don't have that condition versus all of our patients that do, and it turns it into a trend line. Okay, the next one over is how do we maximize this? Let's say we've got some intricate detail and we want to drill in and see, you know, what happened here, how are things going. Let's just click the maximize, and what that does is it brings it up full screen just so we can see it a little bit better. Okay, at any time, you can even click and drag, okay, and if I let go, you'll see it zooms into that date range. So probably not as relevant as we get started because there's not going to be a lot of data, but as we use this tool, you know, over time, let's say we're tracking something over a year, maybe you want to drill down to a certain month and take a closer look. At any time, you can click that reset zoom in the top to our entire history of data. Okay. I'm going to go back to the view, and I'll show you one other piece. What I found as well is that sometimes when you're looking at this data, it may be helpful to see, you know, at a point in time, you know, what is my prevalence in comparison to the rest of my patients. But if you're looking at just the change over time of a condition, you might not want to consider the other segment. So you can right-click on some of these and look at just one. So right-click, show trend, this actually automatically just brings me to the hypertension prevalence alone. Okay, and it's going to show me the amount by date. Okay. Now what I want to do next is just show you, you know, when we're sharing, what do we see? So I'm going to click on that again, and I know I disabled it for click from earliest. Okay, and here's the value, right? If I go ahead and click that trend now, I'm going to maximize and trend it. Now let's change it to a trend. And again, I apologize, the demo database is not showing the same as it would in an environment, but the dotted line represents the average. So let's just look at over here, perhaps. Okay, you can see that the actual colored area and solid line is looking at my data, but when I'm looking at the dotted line, I'm looking at the average of all of those who are participating as well. Not only that, but as a physician, I can see how many others are participating, how many other doctors are sharing. Okay, and that's in comparison to all the other patients. Okay. So in terms of the data tables, we can't trend that information because that's just a point in time. But as for all the graphs here, we can convert those into timelines. Okay, so this is just helpful for the doctor to see, where have we gone with some of these conditions, and also, what is that average of everyone else who's participating. Okay, but in order to get that aggregated average, you do have to share your data. Okay. Now, the last piece that I just want to talk about is just help documentation. I know I already talked about being able to hover over and access help for that specific metric or that specific tile, okay? But at any point in time, they can click in the top right as well and access help about the outcomes dashboard, okay? So there's some more information up in here about how everything operates. So at any time, if you have a question, if physicians have a question, this is a great space to go to. And of course, as you go forward, please feel free to reach out to me. I'm happy to answer any questions and support you in this process as well. Any questions? Was there anything that that maybe we're not clear on, and there's anything that I need to take a closer look at? Okay.
So
what we'll
the chat line's clear too, Pierce. Yeah. Yep.
Okay. Well, we'll take that as a good sign. Next week, what we'll do is we'll focus again. What we talked about today was what is in it in the EMR for the physician and what you'll see. Next week, we'll talk about your RST tool, how you can utilize that to support physicians and how that works. Kelsey, was there any other points that you wanted to add?
No, I just, we do have 10 minutes or 9 minutes left. I will still try to end a couple minutes early, but or Aaron, if either, I just wanted to circle back to sort of the question that has come up around how to message this and whatnot. And I just thought if Maya or Aaron wanted to kind of share a little bit about the work that they're doing in Cowichan and how they're using their viewer dashboard in the context of their work and preparing and supporting the practice, that would be great. If you could just say a few things, that would be awesome. We're not probably going to have time to get into a lengthy discussion, but more to come on Tuesday. So Maya, are you still there?
I am still here. Yeah, thanks. So yeah, I'm happy to share a little bit of Aaron and mine's experience with the Cowichan project. So essentially a very similar dashboard setup, measurement of the disease prevalence of a few specific conditions that the division decided they were interested in learning more about. So they have I think 12-ish physicians at this point in time who have agreed to share their data. So similar dashboard in MedAccess, similar button to push to upload and share with the division. So the outcome on the other end, the division has access to that aggregate data, as do myself and Aaron. Really, the purpose of this for them was to try to get a community-wide look at some specific disease prevalence. We're a little bit lucky in Cowichan in that we have, 99% of our physicians are using MedAccess, so all in the same EMR, essentially. One Wolf clinic that will be using this this dashboard that Pierce has or a similar one that he's just shown us. But really, they're wanting to get a grasp on the community level prevalence. we also have built into the division dashboard the frailty scale so that they're able to look at the registry of frail seniors, which ties in with their elder care project. It's been super helpful for me in generating some conversations around our panel assessment tools, for sure, because it all really ties together. So if I have a physician who's enthusiastic about wanting to share their data with the Division of Family Practice, I have the ability to then go through those panel assessment tools, ensure that everything is clean and tidy if they feel like it needs to happen, and then push the aggregate to the division. I'm not sure, if anybody has any questions around that, but it's essentially a very similar tool, just the purpose behind it slightly different, so slightly smaller scale for them.
That's great, Maya, and I think, you guys have the added benefit of having the division support, so I'm sure that they did a lot of work around the messaging and engaging their members, which is, going to be a little bit more of a challenge, I guess, for us around this pilot, only because people that are participating are coming from all different areas of the province, involved with different divisions, so we're going to have to really work hard. But certainly I would love to connect with you and Erin again offline just to talk about some of the messaging, maybe if you're willing to read what we're drafting, to have a look and see if it's jiving with some of the questions you guys have had.
For sure, and I think that would be great, Kelsey, and I can say as well, I have had several questions from several doctors on different occasions as to who is the owner of this data. Of course, they understand it's aggregate, they understand it's de-identified, but they still have the question around who does it really belong to when I push that information out. So there will be, I'm sure, some conversations around that on a provincial level too. But
yeah, for sure. Okay,
it's a
great.
little easier sell on the community level.
It is, for sure. We'll get there. It's going to be a work in progress, and we have to be okay with the fact that some people will kind of prefer to not right now, and that's okay. But we work with the ones that want to and continue to share those good stories and how we're using that data and how it's helping with the support that they're receiving, and we just need to keep focusing on that piece. Okay, well, thanks so much, everyone. Thanks, Pierce, for your time today. That was a great presentation. I've had a few notes on the chat line thanking you. Just a reminder that we recorded the session, so Erin will be sending out a link to the recording soon, so you'll be able to go back and refer to it, and we hope you can join us next week. Goodness, is it Tuesday? I'm just looking at my calendar. Tuesday, yes. If you haven't received the invite, you will shortly from Erin Picard. So I really hope you can make it. Again, we'll record that. But that will be the more deeper dive focused discussion on the RSP viewer dashboard. So looking at what you will see. Thanks everyone so much. Have a great morning.
Thanks everyone.
Thanks guys.
Okay. Thank you. Bye.